As Health Matters Uganda, we always come and discuss about health conditions that affect people in our community. And today, we are discussing about drug misuse. My name is Nwamanya Davis. I'm a public health practitioner and a pharmacy technician. Now, what does drug misuse mean? Now, drug misuse is a combination of very many things, ranging from getting a drug without a prescription, without even proper diagnosis, to sharing of drugs, to not completing of dosages. On this episode, we shall discuss the dangers of drug misuse. We shall look at the commonly misused drugs, and on top of that, we shall see how we can avoid all of this. Now, us as Health Matters Uganda, we always come here, talk about a condition and how people can prevent it. Now, having looked at drug misuse, let us look at the most commonly misused drugs. One of the most commonly misused drugs are the antibiotics. For antibiotics, the most commonly antibiotic is amoxicillin and ciprofloxacin. Most people take these drugs anyhow. You find someone is having just flu and is taking amoxicillin. What are the dangers of taking these drugs without proper diagnosis? These antibiotics, the moment you misuse them, they will cause what we call drug resistance. You will take that drug for without a prescription or without knowing its disease, and with the time you will get the same disease that requires the same drug and you won't get healed. So let us avoid misusing antibiotics. Another set of drugs that is commonly misused are the painkillers. Painkillers like ibuprofen, paracetamol, the one you know as Panadol, and others, all NSAIDs. Most people misuse these drugs. They take them daily. They do not go to see the doctors so that they get to know how to use these drugs properly. So let us avoid misusing painkillers, because the moment you misuse these painkillers, you might get serious dangers, serious complications like kidney diseases, like liver diseases, and these painkillers can even cause stomach ulcers, or what we know as PUD. So let us always follow the right procedure. We get diagnosis, we go to doctors for diagnosis, we complete these treatments, because taking painkillers every day is very, very, very dangerous. So we have also people who tend to misuse sedatives in the form of syrups and other forms. So most people tend to use sedatives for relaxation and to feel comfort and other things. These sedatives always cause addiction, and it is very, very dangerous. The moment you get addiction due to misuse of any of the drugs, it will take for you time, and it will be very, very costly for you to quit it. So let us avoid misusing sedatives. Some people may not understand sedatives. Sedatives are the drugs doctors do prescribe for other medical conditions, but others who have some knowledge about them, they always take them to feel better. We have people who also misuse anti-malaria drugs. Anti-malaria drugs like AL, or what we know as artemether lumefantrine. Most people call it Coartem. That Coartem drug, most people have misused it, because the moment they get any sign of malaria, maybe a headache, maybe increased temperatures, they always rush to buy for themselves that drug without even testing, and it is very, very dangerous because the moment you get resistance, it will take for you a lot of money, and most people do not know how to take these drugs because like an anti-malaria like that Cotam, the moment you take it without knowing how to take it, because it is taken according to kilograms of that person, you get to know about the weight of a person and you can easily give the correct dosage. So most people, you have not even weighed yourself, you don't know your kgs, and because your friend or yourself you have got a sign of malaria, and sometimes it is not malaria, sometimes it is another condition, but it comes with similar signs, so you always rush to drug shops and pharmacies to buy those anti-malaria drugs. Another set of drugs that is commonly misused, we have the steroids. Dexamethasone is the one that is commonly misused. Most people take it for allergies, and it is very, very dangerous. With the time it can cause diseases like diabetes and others like we have other conditions like obesity. So always avoid self-medication. All of these medications, if we are to use them, let us use them in a correct way and we follow correct dosage, because the medicines that we use to save lives can be the same medicines that can cause danger to our lives if we do not follow the right way. Now, like I've told you, the moment you misuse any of these drugs, there are dangers that are associated, because one of them is treatment failure. Sometimes you take that drug and you do not get any changes. It is the right drug, you take it in the right dosage, but because you have misused it earlier, already it has caused the resistance in your body, so it is not going to heal you for that condition, because already the body cells are already used with it, so it may not have serious impact. Like I told you, these drugs cause serious damages to some of the organs of the body. I talked of NSAIDs, painkillers like ibuprofen and others, piroxicam, mefenamic acid. There are so many NSAIDs. All of those, the moment you misuse them, you can get stomach ulcers, or you can get what we know as peptic ulcer disease, and you find like you have been trying to heal the pain of a certain organ of the body, you end up destroying another organ of the body, because they also affect the kidney and the liver at large. So what should be done for us to avoid all of these dangers of self-medication? One, always visit a qualified health practitioner for proper treatment and proper diagnosis. Magara Pharmacy in Mbarara is there. It is willing to give you extra guidance on how you can use certain medications. They give correct dosage, and they even explain on how you use those drugs with other things. For example, drugs like metronidazole, you're not supposed to take metronidazole with the ARUC.